Mes chers collègues,
Colleagues, ladies and gentlemen, we will resume our work for the second part of the session, and I call the meeting to order. I would like to inform the committee members, as well as our guests, that interpretation is available in English, French, Italian, Russian, and Polish. And I would like to thank our German-speaking members for their understanding. We have twisted our rules a little bit, but for reasons of logistics, we were unable to have one additional language, and in order to welcome our Polish guests properly, we have allowed for Polish to be used instead of German. Thank you very much. Researchers, members of the institutions, guests, thank you very much for having accepted our invitation to come to this exchange of views with the members of Parliament of the Council of Europe, and I would like to thank the Minister of Health of Poland especially for having come here. Following the hearing of the 26th of January of this year in the framework of the preparation of a report on the handling of the h1n1 pandemic, more transparency needed, whose rapporteur is here, the committee decided to hold a second hearing in order to provide additional information and to hear additional information on the way in which the h1n1 pandemic was handled at a European level. I would first like to ask the committee members whether they have any objection to making public Mr. Flynn's report, that is to say, to make it available for public circulation. I think it is in the interest of everyone that we practice the transparency that we claim, and so I see no objection to this. I would also recall that the press conference will be held in this room after our meeting at 4:30. In your files, you have the program of the hearing. We will hear the Minister of Health of Poland, and with her, we have Mr. Marek Twardowski, the Under-Secretary of State in the Ministry of Health of Poland. We have Professor Marc Gentilini, a member of the French National Academy of Medicine and of the Social and Economic Council here in Paris. We also have with us Dr. Tom Jefferson, doctor, MD, and researcher of the Cochrane Acute Respiratory Infections Group and Cochrane Vaccine Field, and Ms. Michèle Rivasi, member of the European Parliament of France, Group of the Greens, and the European Free Alliance. I would like to thank you for having come to this hearing, and I would also like to welcome Mr. Gérard Bact as observer, who is a member of the National Assembly of France, Mr. Marcin Wisniewski of the European Commission, DG Health and Consumers, Mr. François Autain, Senator, who is the chair of the Inquiry Commission of the Senate on the flu, Ms. Dominique Bouchacourt, the Deputy Director of the Senate, Head of the Mission, Mr. Pierre-François Copolani, Administrator of the Senate Services, and Delphine Lebrun, Administrator of Senate Services. I would like to inform the committee members that the World Health Organization has accepted that we receive Mr. Flynn and myself as chair of the committee on the 15th of April in Geneva for a study visit which will allow Mr. Flynn and the committee to finalize Mr. Flynn's report. And I would like to thank the WHO for making itself available and for its openness with respect to the dialogue with this committee. Here again, if there is no objection coming from the members, I would like to ask you to appoint me officially to accompany Mr. Flynn to Geneva. I would like to give the floor first to Mr. Flynn to allow him to give us his view on his meeting with Gillian Maron, the Minister of Health in the UK. Perhaps you could say a few words to your report first.
I wish to hear at greatest possible length the evidence of the very distinguished guests that we have here today. We know that the warning given out by the World Health Organization last summer resulted in a calamity, resulted in the waste of huge sums of public money, about £1 billion in my country. We also know that it frightened the world, probably unnecessarily, with the idea that there were going to be tens of thousands, possibly hundreds of thousands of deaths. And we also know that the result of the warning was that the whole priorities of health services in many countries, including my own, were distorted. Money was being spent defending against a form of flu that was very mild. Now we're simply looking after the truth. We want to find out what happened, why it happened. The empty chair is probably very significant this afternoon, and that's the chair that's not occupied by the World Health Organization. Of course, I will take the opportunity of going to Geneva with you, Madame Pasquier, and we will question them in great detail on the basis of the evidence we have today. But unfortunately, the testimony that we had from the World Health Organization in Strasbourg was not convincing. They still want to rely on secrecy and the privacy of the people involved. We don't know who took the decisions, who decided that this was going to be defined as a phase 6 pandemic, which resulted in great alarm throughout the world. We did know, and we do know, that there was great pressure, commercial pressure, because huge £4 billion of investment had been made beforehand. So there were people who had a vested interest in making sure that huge numbers of vaccines were bought, and we're not reaching any conclusion on that, but I think we have to see that billions of pounds of profit were made by the pharmaceutical companies, and we're entitled to ask what were the interests of the people that were involved and who were the people involved. And I think that's all we're asking for. The great danger, in my view, is that if the trust in the World Health Organization is undermined, and there have been a whole series of scares throughout the world, SARS, CJD, AIDS up to a point, the millennium bug, avian flu, and now swine flu, where there have been great warnings of terrible calamities, and they haven't occurred. And I think the danger is that, having cried wolf so often, the public, next time there might be a real scare, there might be a virus that mutates, and very few people will take notice of it. And we don't want to see the trust in the World Health Organization undermined. And that's part of our duty, I believe, to get at the truth and to make sure that confidence in the World Health Organization is rebuilt. Thank you.
Microphone, please.
Pardon, je recommence.
Thank you. I'll begin again. I think you've all understood. You each have 15 minutes available to you, which will allow us to have a discussion with the committee members subsequently. I will begin by giving you the floor, Madam Minister of Health of Poland, Ms. Kopacz, who will inform the members of the committee on the handling of the h1n1 pandemic in your country, in particular the government's refusal to launch a vaccination campaign. You have the floor.
Madam Chair, ladies and gentlemen, thank you very much to the Parliamentary Assembly of the Council of Europe for taking up a subject that gave rise just recently to so much emotion and controversy. Thank you also for making it possible for the Polish Minister of Health to share her experience and the actions that we undertook during last year's flu pandemic. A pandemic whose announcement cost the world's taxpayers hundreds of millions of euros and at the same time ensured enormous additional profit for producers of vaccines for the pandemic. Ladies and gentlemen, the Polish reaction to this flu pandemic threat, a reaction that was quite different from that prevailed in many other countries, was not the result of lightheartedness or slow decision-making. From the time when in March and April of 2009 the first information was available about people falling ill with flu caused by a hitherto unknown virus called h1n1, the Polish Epidemiological and Crisis Reaction Services immediately prepared themselves, analyzed the situation, and proposed appropriate measures to react to the possible threat. We also remained in close touch with the ECDC and other European and national centers designated to combat the new virus. Our actions were undertaken in accordance with a national pandemic plan developed on the basis of the WHO's guidelines. Experts on epidemiology and infectious diseases issued recommendations for doctors and other healthcare professionals. We conducted a broad-ranging information educational campaign, in particular aimed at children and school-age youth. And we also made sure that we combated symptoms of panic and social unrest or unease. It should be added that the relatively rapid announcement of successive levels of pandemic threat by the World Health Organization caused a lot of interest in the media, which didn't really verify the significance of the figures that were provided and started to talk about an upcoming apocalypse. The media, of course, reminded societies of the famous Spanish flu of 1918-1919 and the more recent avian flu, which raised the level of social disquiet without really facts to support that. And that is why we prepared and transmitted information in accordance with our pandemic plan, and we used the medical information that was available about the degree of threat, but that was often marginalized by the media, and they concentrated on the threat. We also analyzed the situation in countries of the southern hemisphere, where the flu season was underway, and we were becoming very aware of the moderate nature of this pandemic. All of this made it possible for us serenely to analyze the situation insofar as the alleged pandemic was concerned and to draw the appropriate conclusions. Ladies and gentlemen, we wanted to take into consideration all possible scenarios, so we invited pharmaceutical companies to negotiate with us, companies that were working on a vaccine against the h1n1 flu virus. The Polish Flu Pandemic Committee had defined a high-risk group, including 2 million persons, in accordance with recommendations of the WHO and the ECDC. And the Polish government set aside resources to buy the appropriate number of vaccines. But the conditions of purchase of these vaccines proposed by the producers were very dubious for us. There was the vaccines were to be purchased only by the government and not to be available directly to individuals and to units of the healthcare system. The producers of the vaccine expected that the Polish government would take full responsibility for any undesirable side effects, so they were offering sale at the risk and on the responsibility of the purchaser. And also, for a long time, it was not clear whether each person should be vaccinated once or twice. And we were also concerned about information in the Udra-vigilance system about various undesirable effects and even suspicion of some deaths. And the fact that the vaccine as offered was 2 to 3 times more expensive than vaccines against seasonal flu produced on the basis of the same technology is something that I shall not comment. Ladies and gentlemen, for these reasons, the Polish government and I personally fully responsibly undertook a decision not to purchase the vaccines under the conditions offered to us by the pharmaceutical companies. And in the Polish parliament, I said at the time, I quote, "Is it my responsibility to sign contracts in the interests of Poland or contracts in the interests of pharmaceutical companies?" I must admit to you that I said this as a doctor who has sworn to act for the good of patients and as a politician who has sworn to act in the interests of citizens. For it really is not acceptable that producers of vaccines, thanks to a media campaign and taking advantage of well-founded fear of people of disease, that they should force governments to take certain decisions. It is not acceptable that producers of medicines should not take responsibility for their product, for the safety of patients, and for undesirable side effects. It is not acceptable that governments should become hostage to interest groups and should take decisions in an atmosphere of panic resulting from alarmist announcements in the media or the opinions of experts who have an interest in the situation themselves and who have not really analyzed the situation in scientific terms. That is not acceptable at all. Ladies and gentlemen, and a rather bitter thought to end. At the beginning of information in Europe about the pandemic, on 30 April 2009 in Luxembourg, during a meeting of Ministers of Health of the European Union, I talked about the need for coordination of purchases and distribution of vaccines by countries of the Union, considering that combating the pandemic should be based on genuine European solidarity. I said that the criterion of access to vaccines should not be how rich a country is, but rather to what extent it is epidemiologically threatened. And I find it very painful to share with you the thought that there was no coordinated action by the community, that the European answer to the pandemic threat, which turned out to be not so serious as we initially thought, has shown that in the European Union there is a deficit of solidarity. And this lesson also shows that the announcement of each successive level and the scale of pandemic by the WHO must be preceded by a very good scientific analysis and correct evaluation of the threat. Premature announcement of a pandemic, elimination of the criterion of the level of threat of the virus by the WHO and using mainly the geographic criterion without taking into consideration the number of cases actually occurring in a given region has resulted in this excessive reaction by most countries in the world. And I think that the international community is expecting now that the WHO reduce the announced level of threat to the actual pandemic situation in individual regions of the WHO, which has not yet been the case. And finally, this test was failed also, and perhaps first and foremost, by companies that produce vaccines, because for them, corporate profit was more important than social responsibility. The experiences of last year's pandemic announcement are a very important lesson for us. We paid a very high cost. What is important now would be to draw the appropriate lessons from that experience. Thank you.
Merci, Madame la Ministre.
Thank you, Minister, for your very forceful presentation. And I'll now give the floor to Professor Gentilini, member of the National Academy of Medicine and the French Economic and Social Council.
Madame la Présidente,
Madam
Madame la Ministre,
Chairman, Minister, members of Parliament, members of the Council of Europe, I am adopting a very humble approach in reporting to you, and with a lot of regret. Humility, because it's not because we were right that we should boast about this, and a lot of regret because I note that the comments which were made, the reports and broadcasts have not had any effect in recent months. In other words, the small voice which we represent was not heard. I think that even the specialized press, the medical press, did not make the effort to report on the different schools of opinion present in France. A major French medical journal, which I asked them, how many times did you cite my name and report on my comments? They said, oh, we will send you a photocopy of the references. And I saw only 4 lines in all, 4 lines. And this week I was offered the interview I'd been dreaming of when the events were actually happening, and I turned down that request for an interview. I'd like to say that if, for my country, if I took the floor, although I'm probably the oldest person present in this room, I'm an honorary octogenarian.
If I took the floor, it was because my successors in the service of tropical and infectious diseases in a major Paris hospital, my successors to whom I'd said, take the floor, give your views, say you don't agree. And they said to me, but sir, it's not possible for us to do this because we have to show solidarity with all the other members of the expert committee. And I thought that response was both human and inhumane. Human because we know how cowardly everyone is, but inhumane because there was no authoritative voice to be heard. But they said to me, but you're free. You're an honorary person now, so you can speak out. So I cloaked myself in my honorability and I spoke out. Because in July 2009 I was fed up on hearing in the media and reading reports which were contrary to what I felt was the truth. And above all, Madam Minister, this climate which you've recalled, this of terrorism, of apocalyptic threats, which was the climate of the press. I won't dwell on the press. It would probably be in bad taste here, seeing their representatives. But there are papers which I didn't read much, but which I don't read at all anymore. When I saw how the facts were reported for the public at large, national, major daily papers, morning papers, which reported on deaths which might be attributable to flu without any proof, or who included among the French fatalities all fatalities, whether they were in France or outside France. This corresponded to a political fact, but not to a scientific fact. And the poor press therefore deceived the public, but the press was also the victim of the information that was being fed to them. At the beginning of August, a major weekly paper which appears it's an evening publication or which appears online, reported something which is quite fundamental as far as I'm concerned, and it was the indecent discourse in relation to the major international health problems, the indecency, and I was talking about the pandemic of indecency. It was indecent from an ethical point of view, in terms of the information given, and from a health point of view, it was completely out of proportion. So for ethical reasons and for health reasons, I felt it was my duty, as from the month of July and August, to speak out. And I don't regret this, although I experienced difficult times. Now we are meeting here in this room under your chairmanship, Madam, but we were not sure that things would develop as they did actually develop. At the time, I was on my own. I felt very isolated in my country. And the reproach, what would have happened had there been a lot more fatalities? What would have happened to people who had dared to say that it was not the disaster scenario which was the most likely one to come to pass? So there was this indecency in relation to health data throughout the world, given the billions of people who are starving, for a fund which required less money than the 27 EU countries were devoting to an announced planned illness, but which did not actually happen, it would have taken far less money to feed those billions. And I would remind you, because I was a professor of infectious and tropical diseases, and I looked above all at the tropical infectious diseases, but malaria, over the same period between the beginning of the epidemic of the influenza epidemic and now practically a year. And this is just an estimate, of course, but malaria is estimated to have killed about 1 million people from malaria, Plasmodium falciparum. But you need other arguments to move decision makers. If we recall that the sums of money announced by the ministries of 1.5 billion some time ago, but I think the final sum was higher, that expenditure corresponded to at least twice the French National Cancer Plan, which runs for a period of 4 years. The figure of fatalities, obviously death is always failure for a doctor, but 350 deaths, more or less, is more or less the number of people killed in the street. Forgive me for using such a trivial expression, but there's not a penny for them. 5,000 fatalities from viral hepatitis in France. Nobody really bothers about them. And I could give you many other examples. But this concept of public health, behind which people were hiding to say we all have to mobilize to tackle the flu, is an argument which is in bad faith. As to the World Health Organization, you know, if I recalled my previous career, it is because I directly experienced the emergence of the AIDS virus and the disaster. The disaster in 1981. In my hospital department, we were in the front line in dealing with this, and the authorities denied the importance of that emerging illness. It was denied. There was general denial on the part of African heads of state in particular. We said, President, this is not an illness just in your country. It's like rubella or measles or malaria. We know that AIDS is an international illness, but 2/3 of AIDS cases are in Africa. And this denial, the World Health Organization had to beat its breast for some time afterwards because they were reminded of this. And if UN AIDS was set up, it was because we'd proved that the WHO was incapable of understanding the scale of the AIDS epidemic. And since the WHO acted incorrectly in 1981, they now have suffered from a complex. They go to the other extreme now. They sinned by omission to begin with, but now it's the opposite. It's excess. And I think that this environment, and also the fact that the Director General of the World Health Organization comes from a flu and virus and neighboring virus background, and she came to Geneva with this concern, a perfectly legitimate concern. One can't criticize her for that. But above all, the World Health Organization as a whole was mobilized on this theme. And over this period, and I think it's Mr. Flynn who recalled this, other problems were not taken into account. So I think this indecency is a first mistake, and the second was the excess. You said, Minister, we knew very early on that the epidemic would not be as serious as people were saying. And I reread the interview of the Director General for Health in France just recently, where he acknowledged that as from the first few weeks, just after the first few weeks, people knew that the epidemic would not be so serious. So why were the decisions not at least discussed? Why were warnings not issued? Or why were they not more restrained in the early months, up to the time when the 94 million doses of vaccine were purchased? So excess on the part of national authorities under the influence of the World Health Organization, because if the World Health Organization is an essential body in the world, it should be the health beacon for humankind, and it must assume its responsibilities and make the right choices. And there, at least twice, it made the wrong choices on avian flu as well. And I think that the proposals made by the Director General of the World Health Organization were quite unreasonable. I calculated the number of actions which had to be undertaken properly to wash one's hands properly. You know, ladies and gentlemen, that if you wash your hands properly, this means that you have completed 11 gestures, one after the other. And when you've gone through all those 11, and if you have a clean towel, you can consider that you have clean hands. This is just outrageous for a lot of people who don't even have access to water, who have no piped water available. And finally, I am looking at the clock, Madam Chairman. I won't overrun my time. This excess was a general problem. Fortunately, our Minister of Health, your colleague, did not agree with the Director General of the World Health Organization for Phase 6. But just imagine what Phase 6 would have represented. That is just completely insane. And the concern for people like us is that such decision shouldn't be taken without clear indications. And the next time there's an epidemic of seasonal flu, which is already just round the corner, which people are already announcing, and you will hear about that, because somebody's got to use these vaccines. The vaccine is stable. Yes, but the virus is not necessarily stable, and the virus will change. But you will be vaccinated, you'll be told to go and be vaccinated, and you will give in to the pressure which will be exerted on everyone to be vaccinated. The World Health Organization made a mistake. They got it wrong. And I think at the outset we were told there are two models which will be of concern to humankind. There will be Spanish flu and avian flu. But the Spanish flu, how could you recall this problem, which admittedly killed a lot of people? We don't know exactly how many. But that was at a different time, different era, and at the time there were no antibiotics. What killed people who had survived the Great War was basically pneumonia and bronchitis. It wasn't the virus itself that killed them. It's as if you were to ask generals, which some did, to fight the next war with the war plans of the 1914-1918 war. I'm amazed at these outdated ideas. Some people said that the avian flu would kill 500,000 people in France. It didn't kill one single person. So this health trap is being repeated again and again. And I think at the outset it's a scam, a health scam. What is? It's not just a few people who are working on with their computers, drawing up mathematical models, who never see a patient, who are not involved in their health networks, or not active in the ground. They're the experts, of course, but also other people. And if we are to review our experience and the expertise, I'm not a sociologist. I'm not necessarily in favour of sociology in every area, but in an area such as a pandemic, if we can actually agree on what is a pandemic, and that's another issue, we need to involve sociologists. Society must be taken into account, and this should not be entrusted just to experts. It's too serious to be entrusted to experts. And I think we're also going to have to take into account the health network in all our countries. I don't know what you did in Poland, but in France, I can tell you what we did and what one shouldn't do. One should not sideline general practitioners. Everyone will tell you, and the ministers involved said before the decision was taken, that the family doctor, the general practitioner, the grassroots doctor was the essential link. But they were completely sidelined. They didn't like this, on the one hand, and secondly, it was a technical mistake. Even if they were multi-dose vials of vaccine, if the doctor had only used 7 of the 10 doses of vaccine, we would still have got a far greater vaccine coverage than having the vaccination done in the gymnasium, in mobilizing the army and the fire brigade. This was all quite out of proportion. And I'd like to say a few words about the precautionary principle. I've hammered this home whenever I've had an opportunity. This is not a political umbrella. The precautionary principle is not designed to protect decision makers. The precautionary principle is a good principle, but it must be used wisely, and here it was used badly. And I would like you to refer to the work recently done by the Academy of Medicine, which give an up-to-date analysis of the precautionary principle. A lot of scientists are quite reticent, quite rightly so, about the precautionary principle, because you're not going to go very far if this is applied excessively. And my final point is to say that we need to act differently. But what really worries me is that when confronted with this indecency, this excess, we're now at a stage almost of impudence. The people who are responsible for this mistake, for this waste, are not even aware of what they've deprived others of because of this money which has been misspent, and they're prepared to do exactly the same thing again. They said, if I had my time again, I would do it again. And our role is to say, no, you are decision makers, but you should take the right decision, not just any old decision at any old price. Thank you.
Thank you very much, Professor Gentilini. I would like to point out in passing that you have made available a biographical note to the committee members for those of you who are interested. And now I give the floor to Dr. Tom Jefferson, MD and researcher with the Cochrane Acute Respiratory Infections Group and the Cochrane Vaccine Field. I would also like to point out to the committee members that Tom Jefferson has made available to the committee members his declaration of activity and of interest, which the members can consult as well. You have the floor, sir.
Madam Chair, Madam Minister, ladies and gentlemen, thank you very much for the invitation. As you heard, my name is Tom Jefferson. I haven't got the time to go into what the Cochrane collaboration is or what it does or how I'm funded, but as Madam Chair said, you can consult that. Today, I'm going to make, if this thing works, I'm going to make 4 points to you before taking questions at a later stage. These are the 4 points I would like to make to you. I will try to stick to facts, and every statement I make I can back up with 1 or more pieces of evidence. Okay, So we kick off with the first one. Influenza and influenza-like illness are not the same thing. Now, influenza is not influenza-like illness. Influenza-like illness or flu, I am using these words interchangeable. So influenza-like illness and flu I will use interchangeably as synonymous. Flu is an unfortunate, strange thing of the English language. Is a general term which is used and misused, and all it does is confuses people. So flu and influenza-like illness are ILI, okay? And they're not the same thing as influenza, which is an Italian word which comes probably from influenza degli astri, which means influence of the planets, because this is what people thought many years ago, that influenza was caused by the planets. Here is what presents to me as a GP, or to me as a patient and to you as patients. We all are familiar with this. This is a description or a definition of the flu, influenza-like illness. It's a description by WHO in 2003, and it's as good as they get. You get headache, you have a fever, you may have sore throat and pharyngitis, you may have aches and pains, and so on. So everybody knows this, but not very many people know that influenza-like illness, or the flu, is not influenza. And the flu is caused by a huge number of known bugs, viruses, bacteria, and so on, but the majority of the causes are unknown, not known. We don't know why that is. It may be that these are bugs which nobody has recognized, or maybe they're non-infectious. There's some evidence, sparse, interesting evidence from all over the world, but these studies are not well funded because no one wants really to know. Now, what you've got to bear in mind is that influenza and influenza-like illness are not distinguishable to the GP, to the family practitioner. The set and symptoms are not specific to any kind of bug. So influenza and influenza-like illness get confused. And one of the consequences of this is that the threat is blurred, but it's also exaggerated. The distinction is essential, because if there is a real threat, we ought to have a good estimate of what that threat is. Also, it's essential to know exactly what the threat from influenza is if we are to use influenza-specific interventions like vaccines and antivirals. Because vaccines and antivirals against influenza don't work against the other bugs. In fact, they probably don't work very well against influenza either, but I'll come to that in a minute. So threat assessment and threat response is very important, but it's blurred. There is a risk of exaggeration. Do we know what the impact of influenza is? To know what the yearly impact of seasonal influenza, if you want, is, we need to know how many cases of flu or influenza-like illness there are and what proportion of these is caused by influenza. So we did just that. My American colleague, Peter Doshi, who is a sociologist, asked 43 out of 51 US state epidemiologists the simple question: how much flu is caused by influenza? Here is a sample of the answers he got. Now, if you're not very familiar with American and Anglo-Saxon slang, I'll summarize it in one line: I don't know. CDC, we too have been interested in the problem. We'll probably do something about it, they said. But actually they didn't. They didn't have a system in place. So these are the guys who run state-financed influenza surveillance systems, and they can't routinely distinguish influenza from the flu because all they're interested in is influenza. They're not interested in the other bugs, but they don't have what we call a numerator and a denominator. They do not have a defined population because they don't know how many people go sick to the doctor with influenza-like illness or flu, if you like. So where do we go for this information? We should have this information routinely, shouldn't we, if we are to take measures? Well, the only way that we can actually get to a close estimate is by looking at the studies, which is what the Cochrane collaboration does, the formal studies that were done on vaccines, on influenza vaccines, and look at the so-called control arm, people who got nothing. They didn't get protected, they either got placebo or do nothing. And then we put in as well 28 studies which were done exactly for this, to answer this question, which were published in the last 10 years. What came out is more than 3 million observations, and here's the answer. Out of 100 people, in a year, 7 will have the flu. Okay? 7 on average. This can go up and it can go down. It's an average over 40 years. 1 is caused by influenza A or B. This is an exaggeration as well, because some 10 to 15% of these guys, blue guys, have actually got more than one bug. So they test positive to more than one virus, one agent. It's only possible to tell them apart with a laboratory test of some kind. I won't go into that. Professor Gentilini knows more about it than I do. So just we can't tell them apart clinically. Now, my first conclusion, therefore, is that no one knows exactly what the threat is. Do we know what we're talking about? But if we cannot describe what is ordinary, what is seasonal, I'll go back to that in a second, how on earth can we describe what is extraordinary, i.e. pandemic? I know what an ordinary speed is on an Italian motorway because it's 130 kilometers an hour. It's written on the thing. If I go beyond that, that's abnormal. But here, I don't know. Perhaps this uncertainty is why WHO has changed its definition so many times since the 1st of May 2009. Okay? We have evidence of at least 3 changes. Before the 1st of May 2009, the old definition with enormous numbers of deaths and illnesses, which is the one I was taught when I was studying epidemiology, of any pandemic, not just influenza pandemic, cholera pandemics are the same thing. Then on the 1st or around about the 1st of May to 4th of May, this changes, and the enormous numbers of deaths and illness vanish. And what we got left with is new virus, whatever that may mean. Please don't ask me what it means because we're going to be here all day. But new virus, okay, and spread. These are the key elements of the new definition. Asked why change, a spokesperson, Ms. Boudou, former spokesperson, Ms. Boudou for WHO, said it was a mistake. We apologize for the confusion. The correct definition is that pandemic indicates outbreaks in at least 2 regions of WHO. But it's got nothing to do with severity and illness and the number of deaths. So now we have a 3rd definition, which is 2 WHO regions. Then Dr. Gregory Hartl, who was interviewed by Swiss TV, Follow, broadcast on the 7th of February of this year, says the old definition was written with avian flu in mind. This is the 4th definition because this implies that a pandemic definition is tied to a specific virus. Okay? Remember that the job description of the influenza virus is to mutate. So we can have a new definition every hour, if you like, or every time we test, if this were the case. Now, if it was a mistake, yeah, but the implications of all this are quite frightening. If it was a mistake, it was a very strange mistake, because, excuse the typo, because there are loads and loads and loads of WHO documents dating from 2003 to 2009 which have the old definition. So it was a very persistent mistake. You can find a quote, a selection of quotes from the documents in my written statement to this Council. So, what do I conclude for this? I think we can safely conclude that no one has any firm idea now of what an influenza pandemic is. And this is not a good state of affairs. I go on to the role of experts and the media. You'll have to excuse me, I refer to experts. I'm not an expert, I'm a researcher. I refer to experts as key opinion leaders. This is important because key opinion leaders is a word which is used by the recruitment agencies of key opinion leaders, of experts all the way around. Much has been said about the role of experts in advising policymakers on both seasonal and pandemic influenza. We know that some of them have been parsimonious, they've been shy about declaring their interests and their role as members of lobbying organisations which are financed by industry, and some did not think it important to disclose pretty hefty industry funding to their institutions. We know that transparency is not really WHO's forte. However, few people realise that even experts with no ties to industry, none whatsoever, and government civil servants have career motivations. Indeed, I have conflicts of interest, and you will see them. I stand up and admit to them. Especially these career motivations if they make policy and evaluate its effects. I'll leave the description of how this works to Professor Philip Alcabez's book Dread, with this quote, wonderful quote, explains exactly how it works. And I say again, I'm not immune to this. Remember that most key opinion leaders do not just spring up like daisies in a field. They are recruited. They are made slowly over weeks, months, years. They're recruited by organisations like SACOR in UK and Wolters Kluwer, who is an international publishing house. If anybody's from Wolters Kluwer, don't bother changing the website because I've taken a screenshot of the appropriate web page. Now, what do I conclude from all this? We wouldn't be here today if the expert system, as Professor Gentilini said, worked. It results that the expert system, in which selection is on the basis of fame or sponsorship and transparency is the exception, are plain for all to see. Catastrophic predictions that have failed to materialise, dodgy science, a thriving pandemic industry, and the reputation of public health which is in tatters. Much has been said also about the media. Here, let me remind you about that. Here we go. Bird flu. More. This is my favourite. Well, yes, but this is... You remember this because your constituents are affected by this stuff. And look at this, National Geographic. This is a highly reputable magazine. The next killer flu. Can we stop it? What about this? And this. Where's it coming from? Mickey Mouse? No. It's coming from there. Ah, but this was bird flu. Swine flu, we didn't have that. No? Okay, if anybody thinks I made this up with paint shop, please tell me now, because I've got the original here. This is the lay media. What about the scientific media that Professor Gentilini alluded to? Here's the evidence. Down the bottom, this comes from a Cochrane review. Down the bottom, this is influenza-related death in the United States, 1986 to 2004. It's more or less a straight line. It goes up and down, which is what you would expect. But it's more or less a straight line. Yes? So that's the threat. That's the bottom threat. The baseline threat. What this is an index of prestige, so-called impact factor, of the journals on which influenza vaccine studies funded by industry have been published. As you can see, the impact factor, the prestige, goes up. The citation rates of these studies go up, and they are no different quality-wise and size-wise from non-industry funded studies, and the threat is static. This thing is packed up. It's kaput. Doesn't matter. The threat is static. So from this, I conclude that influenza vaccines are, by and large, a media phenomenon. Vaccines and antivirals. These come from our Cochrane reviews, these slides. Here is how influenza vaccines in healthy adults perform in real-world conditions. This is 40 years' worth of data from 42 clinical trials, 80,000. This is the best possible available evidence, and it's the best performing age group because it's the one that's got most immunity. You need to vaccinate 100 people, 100 members of the public, to prevent one set of symptoms. Not death, one set of symptoms. Not pneumonia, one set of influenza symptoms. If you're interested later on, I can show you how this same information can be spun in different ways, can be doctored in different ways. Now, antivirals. Well, antivirals are similarly effective against symptoms, but some of them are toxic. Some of them are very expensive, and they may not prevent complications from influenza. The publicly available evidence suggests that drugs like aspirin may be just as good and less dangerous than the drugs that we have stockpiled to the tunes of billions of euros. This, of course, is never mentioned in the media. What else can we do? Again, it's been mentioned. Well, we can hand wash, because that's where the best evidence is. We can use masks and we can use public health measures. But public health measures, although they have a much better evidence base than vaccines and are socially acceptable and cheaper, as well as being lifesavers in very poor countries, they're almost ignored. For example, in the most recent 62-page guidance document on planning for pandemic influenza from the World Health Organization, hand washing and masks were mentioned only twice. Gloves and gowns, once each. But vaccines and antivirals were cited 24 and 16 times respectively. Compare this now with what I've shown you. This is the effectiveness of hand washing more than 10 times a day against the case of SARS. This comes from 6 case-control studies that were carried out during the SARS outbreak in Southeast Asia, and it comes from one of our Cochrane reviews. 59 clinical studies in this review, all that we could find. In conclusion, I have absolutely no idea what the future holds, other than continuous alarms and possible declaration of pandemics, whatever they may mean now. But if the complex interplay of poor science, key opinion leaders, media business, pharma business, pandemic business, and unaccountable decision-making is not interrupted, we will have more similar episodes, more of the same. Scientific evidence, systematically assembled and weighed by its quality, needs to be centre stage, and not like a pretty maiden whose services are called upon on demand. Thank you very much for listening, Madam.
Thank you very much to you, Mr. Jefferson.
I will now give the floor to Ms. Michèle Rivasi, Member of the European Parliament of the group of the Greens. We've left it to the end to have a better coordination between the investigation members of the Council of Europe and the European Parliament, which you represent here today. Thank you, Madam Chair, Madam Minister, members of Parliament, ladies and gentlemen. First of all, I would like to congratulate you on holding this meeting, and I would like to congratulate the rapporteur on this as well. You see, it is a political meeting, it appears, with respect to what happened with respect to the pandemic, and the fact that we can bring together the European Parliament and the Parliamentary Assembly, the Council of Europe, is important with respect to our population. population, because as you said earlier, if we no longer have trust, well, first of all, next year we will be entitled to another pandemic, seeing the way things work, and since the virus will be truly virulent, nobody will put their trust in us anymore. So I think that what we need to work on now is to regain the credibility of our population, and we need to work towards change, because what we are doing now, that is to say denouncing what has happened in the past, is important, but we need to work on concrete proposals with respect to the WHO and other bodies. As a biologist, I saw how things were unfolding, and even though I'm not an expert with respect to the WHO or pharmaceutical labs, but with the data that we had available to us, we were already able to question the way things were presented to us. I think that there are several types of responses that we can have. First of all, we can ask, what is the justification for the pandemic? First of all, I looked at data, and in particular I looked at all the WHO alerts and reports before the pandemic was declared on the 11th of June 2009. And I think that what we find ourselves confronted with here is manipulation. Now, this is without even speaking about the media. We're dealing with basic manipulation. It started on the 10th of April 2009 when the WHO signaled that there were flu cases in Veracruz in Mexico, and all of a sudden we saw that there were very many people who had respiratory problems. Very early on, Mexico, at the request of the WHO, signified that there were more flu cases. We don't know whether this is h1n1. On the 22nd of April, the WHO confirmed that several cases only throughout the country were in fact due to the h1n1 virus. Only 16 cases of the 50 sent to Canada. And this was in this small village where everything started in La Gloria. Only one of these cases were confirmed as being due to the h1n1 virus. Now, the media, and in particular Mexico, closed the schools, quarantines were declared, and this is when the media came in. Pictures were shown of people wearing masks. It's a whole a specific way of presenting things that was rather deliberate. Now, what do we know? What did we know at the time on the number of cases? Very little, in fact. It then seemed that there were 2 cases in the United States, in California, and on the 26th of April there was a press conference held by Mr. Fukuda, who said that there were 11 people with the flu in the States, 16 people in Mexico, with 0 deaths with the h1n1 virus, which was new but benign. So this was declared on the 26th of April. On the 6th of May, there were more cases, 949 cases in Mexico, of which 42 in deaths, several hundreds in other countries, a total of 100 deaths. With no deaths. On the eve of the declaration of the pandemic, the WHO declared that the majority of cases were benign. So the cases were benign, the virus was benign, and nevertheless, on the 11th of June, the pandemic was declared alert level 6. What I wondered about when looking at these facts is the unfolding of this all. Even when we look at the WHO notifications, we have the feeling that the WHO deliberately staged the events. 75 countries had notified a total of 2. A little bit later, there were 74 total cases, and eventually over 140 deaths. Now, these 140 deaths were declared much later. So when you look at deaths, of course, these are that many deaths too many, but it had nothing to do with the number of deaths in what we would consider a pandemic. Now, the second thing that the WHO declared was that this was an entirely new virus. Now, what do we see on the 22nd of May 2009? We see that 10% of the under 60s and 30% of the over 60 year age bracket already have an immunity against this virus. So we say, well, why stage things in this way? Why manipulate things in this way when the virus is used in this way? Now, I hear your criticism. I had established a committee after the Chernobyl cloud, which famously did not cross the French borders. But when the virus occurred, the media had the official data, and the media jumped on this and says, oh my goodness, all these children, the children will die. Now, I spoke several times with the Minister of Health of France, Ms. Bachelot, and I said, why worry these things so much? Why create such alarm? You are being alarmist. And when we look at what happened, you said what happened in Poland, and when we look at what happened in Australia, there were no greater number of deaths amongst children. And I heard a conference with Ms. Bachelot, the Minister of Health of France, who said, do you realize it's the children who are dying? And I said, it's not true, Minister. These are the figures from the Ministry of Health, and they don't indicate that there are more deaths amongst children. It is, however, a contagious virus. Well, here, Mr. Gentilini, you raised this. You see, on Chernobyl, I had the same effect. The doctors that were around the table, they were saying the same things as Ms. Bachelot, as the minister. Not one of them said, let's just look at the figures, let's just look at the data, and let's stop alarming the population. This is very problematic. Amongst peers, we don't want to attack each other, and I think this will be a problem for us when we want to speak out. So when I looked at the data afterwards, and you're aware of this because I saw it's in the file, we could see that this was the chronicle of an announced pandemic. You know the book, The Chronicle of Announced Death? Well, this is the chronicle of an announced pandemic. And I have all the documents in the annex from the pharmaceutical labs. It was stated that they were waiting for alert level 6 to launch the production of the vaccinations. And that's what happened. As early as the 11th of June, that's when it all started. Well, that's when the vaccines became to be made. But within an inquiry investigation, we have to look at the reasons. Why did the WHO only bring together 4 labs? Why, when we look at what happened in the United States, for example, all the labs were invited, the Chinese, the overseas labs, all labs. Here, it was only 4 laboratories that were convened, and that led to the question of the patentability of the vaccine, because the usual seasonal vaccine costs about €1, and here we have a price range of approximately €10. So this also gives rise to some questions, including the patentability. So as a scientist, but as a politician too, I called on our minister, Ms. Bachelot, to ask some questions. I said, why are we rushing into this so quickly? And there were several of us wondering about these issues. So I was saying, why not bring in more scientists, more doctors? Let's be critical. And indeed, I was criticizing the minister's position. One other question I was wondering about is the issue of the new vaccines and the whole problematic issue of adjuvants. As early as April, I said we need to be cautious. We need to apply the principle of precaution. The alarmist statements were already circulating. More than 30% of the population was supposed to be affected, and so on. But with some distance, we saw what happened in the southern hemisphere, and we could have a good view of what was going on. But it was said, once the machine is launched, we can't stop it anymore. The process is unstoppable. But no, we had to reorient things. But this is what happened. And this is not only with the complicity of the scientists, but with the administration as well, the WHO and the European institutions. The WHO is being heavily criticized. There are many things that have to be reviewed within the WHO. You said that the WHO had not been aware of the AIDS epidemic, but recall what happened to asbestos and its reaction to Chernobyl. And you know why they didn't sound the alert for Chernobyl is because they're linked with the IAEA, the International Energy Agency. So there's a lot of things that need to be criticized about the WHO, but the principle of precaution is not equal to the principle of excess. So we need to readjust things. And with respect to the vaccines, I'm a member of the Health and Environment Committee within the European Parliament, and we wondered there why we needed to produce fast-track vaccinations. That is to say, use a prototype where it was considered that authorization could be granted with respect to Baxter vaccines, such as the Cevalpan, as well as other vaccines, the pandemics, and Focitria. We'll come back to this. The Sanofi vaccines were used only in France and maybe some other countries. But in any case, we wondered why the Bitusquolin, which is not authorized in the States, but is authorized in Europe, was used. And what about mercury, which was used as a conserving agent? Even the WHO said mercury should no longer be used. So you see that we were in contradiction with our own rules at the level of the WHO. And one thing that I was very much concerned with is the quality of clinical studies. When I looked at the pandemic and looked at what the laboratories of the EMEA were saying, there were studies on 200 healthy individuals who were vaccinated, and there were 7 deaths. So you wonder why such a vaccine was authorized. When I look at another study, 405 children between the ages of 3 and 9, there were 2 cases of hepatitis as a result of the vaccination. So we need to be very vigilant, and we need to ask why such vaccines were authorized. Now, I put these questions, and I received the answers from the ECDC, which said that indeed it's the first time that vaccines were authorized with such a low level of clinical studies, a low number of clinical studies. And in the inquiry committee, we asked what was the vaccination strategy? Who decided to vaccinate this population massively? Why was this not done only with respect to the at-risk population? I had access to the document on the WHO vaccination strategy, which said that that pregnant women had to be vaccinated as a priority, for example. Now, I put the question to the ECDC. I spoke with the director at the time, and I asked her, given the data you have on vaccine, will you be vaccinating pregnant women? She said, for the time being, not at all. There are no clinical trials. We will have to wait at least until December. Well, the information coming from several countries is we will be vaccinating pregnant women. So you understand that whether you're a politician, a scientist, or simply a citizen, you wonder about these things. Then there was this story about the double doses versus the single dose. There were data on children, but there were very few clinical trials on children. Now, do we produce the vaccine then with adjuvant or without adjuvant? So all of these questions relate to the quality of vaccination, and they must be asked. Next. There are not many people talk about the vaccines, but not many people talk about the Tamiflu. And I think Tamiflu is one thing we have to discuss as well. When I looked at what the supposed efficacy of Tamiflu rested upon, I looked at one article in the British Journal which accused La Roche, which is the company that brought out Tamiflu, saying that it was based on 10 studies. When experts asked that these studies be conducted, only 2 of them were published in scientific journals, but the original data of these trials were lost. The only trial which was published shows that Tamiflu is no better than a placebo. The Japanese health agency showed that Tamiflu could have adverse effects amongst adolescents, that it could lead to depression, psychiatric problems, and so on. So here again, this causes us to wonder about who evaluates medicines. Because I will remind you that Tamiflu was made mandatory treatment in France by a ministerial note, because at the beginning it was not on sale in pharmacy, and the ministerial note stated that it had to be made mandatory. Now this is when doctors reacted. They said that given the studies that they had available to them, they did not want to prescribe Tamiflu to their patients systematically. So you can see with the example of Tamiflu that we have a problem of the trust that we can place in the medication available to us. And here again, I put the question to the WHO. Why not have these medications appraised scientifically? Now, at the European level, an investigation commission was launched. Now, in order to have such a commission authorized, you need 1/4 of the European parliamentarians asking for it. So we need 183 signatures. All the deputies that signed, first of all, it's deputies from every political color and from every country, including Poland, because people want to know why that much money was spent. That's the first reflex that an MP has. But now they're wondering about the validity of the vaccines, the vaccination strategy as well. So things now, let me make things clear. These are not people who are against vaccination as a matter of principle, but there was a fiasco. There's a position of Greece, for example. Greece spent millions of euros to buy these vaccinations. Now you, at least in Poland, saved that money. But at the same time, you didn't have the secondary effects. Now here is where I'd like to put another question. When I looked at the documents provided by Sanofi or others who say that laboratories will no longer be responsible for secondary effects, it is the users, therefore governments, who will be responsible. Well, I'm now drafting a report on pharmaceutical vigilance for the European Parliament. And what I'm focusing about, amongst others, is who will receive the notifications of the secondary effects coming from the medications. Now, I imagine Ms. Bachelot, the minister, is responsible for the secondary effects stemming from the vaccinations. Now, if there are many secondary effects coming from the use of Pandemrix or Phocitria, who will be responsible? Who will be responsible for collecting the data? It's the government that will be responsible. So on a European level, see, this goes through Europe and the national bodies. But you see that this is a problem of liability. Before, it is the laboratories that were responsible and liable for secondary effects, for side effects, and now it is the governments that are responsible. And finally, the last question, which we will have to look into with the Inquiry Commission of the Council of Europe and the European Parliament, is the financing aspect. Now, EMEA is financed to 80% by the pharmaceutical companies, but the WHO is now asking that every state accept the fact that the WHO be financed by the profits that the pharmaceutical labs will make on the sales of vaccinations. I don't know if you realize that the WHS should be financed from the profits from vaccine sales. So I can tell you there won't be just one pandemic per year, there'll be 3. And now this is maybe a caricature, but the more people are vaccinated, the better the WHO will be financed. So this is a very serious situation. It's extremely serious because, first of all, there are organizations such as the WHO, which we must transform. You have spoken of transparency, you have spoken of conflict of interest of the experts, so all this has to be made clear. And at the level of the EMEA, which provides the authorization for the vaccinations, and here again I recall that we still don't have the experts' declarations, things have to change. And in addition to providing a fast-track authorization, there is no guarantee that the clinical trials are have been done properly, so there's a risk there. And you spoke of a shortage of solidarity. Indeed, you're quite right. Now, if every country then makes its own contracts with the laboratories, that just means that anything goes. So we have to make sure that with the European Parliament and the Council of Europe, we work together so as to ensure that we achieve greater credibility, greater expertise, and that we rebuild trust amongst people and policymakers, politicians, because now we can see that the power of money is holding the political power hostage. And if the focus is on vaccines, then we won't be focusing or financing anymore research or prevention of diseases in Africa, tuberculosis, or anything else. And this is why I am very highly motivated in favor of the establishment of this committee. Thank you very much, Ms. Rivasi. I think what you've said now merely confirms that we need to work together in order to be as effective as possible to provide the answers to these in-depth questions. We will now move on to the discussion phase of this session. And I would propose that we hear several comments or questions, and then we will hear our guests to respond. I will begin with Mr. Jacquard.
Thank you, Madam Chair. I'd also like to thank the speakers. I myself am a French hospital doctor as well, and I followed all the meetings on flu in France. I just have two questions to put. The first, as Michel Rivasi said, the WHO was directing all this. I'd like to know why. Why were they staging this influenza? Also on the experts, both at Council of Europe hearings and those at national level, on experts, even though I hear these criticisms, the fact that they're not funded by governments, by public money, but by private laboratories. What definition do we need of a true expert? What are the drawbacks the WHO should avoid? Because I remember in Strasbourg a Japanese representative was present and gave a very Cartesian scientific presentation, and it all seemed to be logical. I'm one of the people who think there shouldn't be one single death because of a lack of vaccination. But second question, since I'm a doctor myself, I was shocked by one thing, whether it's France or abroad. So the very low number of doctors who got themselves vaccinated, they're the people who are dealing with infectious diseases, and they didn't have the vaccination themselves. And that was something that really interested me, that intrigued me. A patient could go into hospital with a given pathology and might leave with X plus Y, which was the result of the flu. Thank you. Mr. Hancock.
Can I, first of all, before I make my comments, can I just confirm that the WHO were actually invited to give evidence to us and to make a presentation? But I think it's even more shameful. I think it's,
yes, I can confirm that.
But nevertheless, I think inevitably predictable as why they are not here. And I think that should not go unnoticed from the note of this meeting, that they failed to turn up. We have an expression in the English language about who pays the piper calls the tune. Now, if ever there ought to be a slogan hung over the door of the WHO, it ought to be that, with a very big question mark, the rest of you better watch out, because it would appear that they have no scruples, do they? The evidence is apparent. You know, our last French colleague who spoke about the lack of doctors who got themselves immunised against it is a classic example, and I would think that's very much true in the United Kingdom as well. I think we really do have to bring into question. I would like to congratulate the four speakers who spoke, the three experts, so to speak, and then our political colleague, not ignoring the fact that our Polish colleague is both a doctor and a politician, but nevertheless I think it was interesting to hear the 3 points of view. It's a long time since I've sat in a meeting where people have been giving evidence to a Council of Europe committee where there was absolutely silence in the room and everybody was actually taking in what was being said, albeit some of us had our eyes shut during different parts of it, but I think not a word was lost. And I think you painted such a picture of an unbelievable situation that's arisen, where the credibility of an organisation has been so undermined by their inability to see the wood from the trees, or in their case, being unable to differentiate between somebody paying them and worrying about where the next pound was coming from, so to speak. And I think that's been the whole problem. And what we have got is what Paul Flynn said right at the beginning of the meeting. The next time somebody cries wolf, the overwhelming majority of people will not be listening. And who do we have to thank for that? We have to thank either the inept bureaucratic dumbness of the World Health Organization or the spiteful, evil manipulation of the World Health Organization by the drug companies around the world. One or other of them have to accept responsibility if there is a pandemic in the future and people don't listen, and they have only themselves to blame. I think the Council of Europe is to be congratulated, and I'm not the greatest supporter of the Council of Europe, but I do think on this issue they have stood up to be counted where others have ignored it. And I say others, and I include many of our governments, because what we've effectively done in the United Kingdom, we've robbed the health service and other facilities in the United Kingdom of close on £1 billion, which could have gone to save the health service from the cuts and whatever else it's going to face as a consequence of the economic situation we find ourselves in. Now that can be mirrored in country after country after country, with probably the exception of Poland and one or two others. But most other countries also invested way above what they could have reasonably expected to have to put aside for this. And they did so based on this absolutely contradictory information, unrealistically sourced information that the World Health Organization put out. I think the drug companies ought to start to think about seriously paying back the money that they ripped off. They could have been no more effective if they'd have wore bandanas over their faces and had pistols and held us up, really, and said, we're going to rob you because we know better, and of course we've got the sheriff on our side. And if this was a Western, you know, you wouldn't know who the villain was in this case, because they're all painting themselves out as heroes. The one thing we know for certain is that nobody was saved because of what was happened, but an awful lot of people will lose out, and some people will die because the resources won't be there over the coming months to pay for the operations and medical treatment they desperately need. And that's the indictment we should be laying at the door of the World Health Organization, a pathetic, tarnished and I think irreparably damaged organisation, which will have to go a long way to bring their image back to where people will trust them again.
Merci, Monsieur.
Thank you. Mr. Bapt, please.
A microphone, please.
Alors, Gérard Bapt, je suis député français.
I'm a French Member of Parliament. I'm Budget Rapporteur in the Finance Committee. I'm not a member of the Council of Europe, though. But I've been following this issue for a while. Firstly, I wondered about the dysfunctioning of national management of the health response to this so-called pandemic, but I realise now that, of course, there's a national responsibility when we talk of vaccine strategy. This depends on the countries. Some of them, like us, have got a protection barrier. They bought masses of vaccines, but they didn't even listen to national experts. The first firm order was the 15th of May to GSK. There wasn't a pre-pandemic contract with them, contrary to Novartis and Sanofi, and that was the 15th of May. And the expert's opinion was issued on the 22nd of June, after it had been approved by the High Council on Health in France. So it was a political decision. We were told that it was an ethical decision because one had to protect all these little French children. They shouldn't be short of vaccines. But as the world production capacity was limited, this meant that we would be taking away from other countries because we leapt in at such an early stage. We were preventing even other EU member countries from vaccinating their citizens because there was a lack of European solidarity. So I think it's the opposite of ethics in Europe itself which emerged. And then the other thing, like Ms. Rivasi, I didn't look at the WHO dispatches, but I did look at the AFP press releases. Whenever there's anything for a national authority, the WHO agrees with it. For example, 5th of May 2009, a Mexican leader said, "We have controlled this pandemic in Mexico." Immediately, the number 2, Dr. Fukuda, said, "The situation is still of great concern." Whereas in Mexico, we now know that it was a health Timișoara which was organised, although it wasn't as well organised as Timișoara, where at least there was motivation to hasten the fall of a tyrant. This was a real media show organised around the flu. When the WHO says we shouldn't lower our guard, the Mexican health minister said, "For the moment, the virus doesn't appear to be any worse than the seasonal flu, which causes 36,000 fatalities each year in the US," and that was the United States health authorities. And the WHO said that this swine flu would be show unprecedented virulence, and it would be the worst epidemic facing the world in the 21st century. So whether there was a reassuring national statement, declaration, the World Health Organization went to the other extreme. And people talked of 30,000, 40,000 casualties, but that's what the press latch on to. So the press aren't responsible for this. They perhaps are over-precipitate in their response. But what we do need to reform is the way in which experts or national leaders react and the arguments they provide. As to the phase 6 of the pandemic, after the WHO changed the definition of the pandemic, has immediate repercussions. This triggers orders of vaccine for the pre-pandemic orders. We had 2 labs, so when it's phase 6, immediately this triggers the orders for the vaccine. And the same pre-pandemic contracts are still in force for next year. So if there's another phase 6 pandemic declared next year, the same contracts for the same labs will come into play again for the 2 labs in question in France. And I assume it's similar in other countries as well. So I think we're now confronted with something which is a European political, indeed a global political problem, and we national members of parliament are hampered. We can't convene the WHO or the European Medical Evaluation Agency. We have to try and work with European parliamentary bodies, therefore. Now, a word in reaction to what Ms. Rivasi said, benefit sharing, profit sharing. I saw that text which comes from WHO executive. It's dated end 2009 and it's due to be discussed in April or May in the WHO. And there's an appendix which says the guiding principles for developing rules for sharing the advantages with the manufacturers of anti-flu vaccines. What does this mean? I went to talk to legal experts, Professor Tabuto, Professor Lod, and they said, we don't know, we can't understand, we really don't know what is meant by sharing the advantages. But if it's what Ms. Rivasi said, you share the profits of manufacturing the vaccines, obviously all the WHO bodies will be wanting to trigger high levels of pandemics all the time. And that's why I think in European level, or you in the Council of Europe, need to look at that. And we should demand that our government, which has a representative in the WHO Council, tells us what this advantage sharing is, because it seems it would just lead to more vaccines being manufactured to fund the WHO. Thank you, Mr. But I think we already have. We don't need any more confusion in the health area. Could I suggest that the speakers give an initial response, and then we'll take more comments and questions from the members of Parliament. Who would like? Minister, would you like to begin?
Thank you very much. Thank you, Madam Chair. I would like, first of all, to react to what was asked by Mr. Bapt, a doctor and a parliamentarian. The question was addressed to Madame Rivasi, but I felt that I should try to answer it because I am myself a politician responsible for health affairs in the Polish Parliament for 10 years now, but I've been a doctor forever. Now, this may not sound very nice, but I can tell you that any death due to the death for lack of vaccine is painful for a doctor. But what about the deaths caused by vaccines? And we have had from centers that collect information about undesirable side effects, we have had information about deaths possibly caused by vaccines. This is, in fact, in reaction to a question that was put by Mr. Jacquat. Why is the pandemic, or the pandemic announcement, still on the books of the WHO? The number of illnesses, the number of deaths, is it sufficient to maintain a level 6 of the pandemic? Maybe the situation is quite different. Maybe it has the time has come to withdraw the level 6 pandemic and ask for very careful clinical trials at level 4. Maybe that is a request that should be submitted to the WHO, and I'm going to be fighting for that in every possible way and in every possible forum. I really want the WHO to re-examine its position and to withdraw the level 6. The fact that vaccines may sometimes be necessary, yes, but when a pandemic is announced prematurely, then anti-vaccine movements come to the fore, and you have this problem of the wolf crying of someone crying wolf when there really is a wolf and no one reacting. Yes, viruses evolve, but there must be an appropriate ethical approach among healthcare professionals as well, and that is something that we fought for in Poland as well. We really don't think that it is appropriate that a pharmaceutical company should hold a pistol to a government's head and say, buy these vaccines or else your citizens are going to die like flies. So I had to look at my ethics as a doctor, look at my ethics as a politician, and I had to take a very difficult decision as a Minister of Health, a very difficult decision politically. I managed to do it, and I fortunately it turned out to be right, but I really would not want to find myself in the same situation again, and that's why I've come here for this hearing so willfully, because I really want you to take up this issue so we are not confronted with this kind of situation again. It is unacceptable.
Thank you. Professor Gentilini.
Oui, je peux répondre brièvement.
I can answer briefly
Quelques questions.
to some of the questions that were put.
L'OMS, je l'ai dit,
On the
c'est une
WHO,
institution
as I've
respectable
said, the
dont il
WHO is a respectable organization which we should defend. We should not let it drift away, and which it is doing now.
normal, moi je trouve que la directrice générale de
In
l'OMS
a normal world, I think that the Director General of the WHO should not be reappointed
elle a commis une erreur ou
because
a fait commettre
she
à
has
d'autres.
committed a mistake and she has had that mistake committed by others. The WHO is made up of two parts.
Ceux qui travaillent.
On the one hand, the staff working in Geneva and experts who have been working in the field, at least some of them, or some of them have been working just in the administration.
Globalement non
So
politisés.
that's the fixed staff, and they are, on the whole, not politicized. But the second part, and those are the ones who have the power over the first, are the countries. Because the WHO is a political tool which belongs to states. It is the states that are the stakeholders, and the highlight of the WHO is the annual meeting, which will be held shortly, and that is when the overall policy choices are decided upon. Now, I don't know if, on the whole, it's a good thing to be organized in that fashion, but I think that what would be a good thing is the depoliticization of the WHO, and that might be a good thing. Secondly, with respect to the failure of doctors to get vaccinated,
Oui, je ne peux pas
Je répète, j'avais pas pris le micro.
I'll repeat, I said that without a microphone. The press had indicated to me recently that even the minister hadn't had time to get vaccinated. At least that's what she said, and that affected me. Well, I understand. I think she still might not have had time. But for doctors to advise vaccination, there are two conditions that must be met. First of all, they have to be convinced that the vaccine is a good one, and that is to say that it is effective, first of all, and that it has no side effects. And secondly, that there's a good indication for a need to be vaccinated. Now, I may be less severe against the vaccines that are advised to us. Nevertheless, overall, the flu level fell far short of what had been expected, so there were no good reasons. And I would say, see your family physician if you want an opinion on this. I personally didn't see any good reason for getting vaccinated. Now, in Dr. Jefferson's words earlier, I believed I had understood that possibly vaccination against the seasonal flu might be questioned as well, and perhaps this might be a good opportunity while we're questioning the vaccination against the pandemic flu, why we should take this opportunity to question the seasonal flu vaccination. It is said that 60% of people who are vaccinated maintain antiviral properties against the next flu, the flu of the following season. Nevertheless, they get vaccinated every year. Now, what I'd like to say to the Minister of Health of Poland, you said earlier, Madam, you made a very important statement, and I unfortunately missed the opportunity to support you in this. You said that the rich countries led the poor countries to make the same errors. The European countries took along with them the poor countries in committing these mistakes. There is no overall agreed health policy in Europe, however, and this is something that we will need to revise.
Professor, Dr. Jefferson.
Thank you, Professor. Dr. Jefferson, please.
Thank you very much. I'd like to sort of say one or two things as I have a distinction here because I pay taxes in Italy and in England. So I've got two votes, if you like. Also, I'd like to tell you that my children, I have 5 of them, and they've all received the recommended vaccinations. So I'm not an anti-vaccine person. I haven't seen any good evidence that mercury causes autism. It may do, but I haven't seen any evidence. I'm not convinced of that. What I have seen is the sovereignty of states being threatened by privates. That's what you were referring to, I think, Minister. Now, I'm not a politician, but I'm a taxpayer. I also believe in the state, and I believe in heads of state. I believe in parliamentary democracy. No one holds a gun to a parliamentary democracy's head unless they want their gun arm chopped off. And I think that this is worth fighting for because it's the most fundamental value that we have. So please, those of you who can, I'm just an epidemiologist, you've got the possibility, fight against this, please, because we vote for you and we are in a system of democracy and it's essential that anybody who threatens our heads of state pays the consequences for that. The second thing I'd like to say is if these interventions are so effective, they're so good, what's the problem with running a large, independent, publicly funded trial of whichever vaccine or whichever antiviral we want? What is the problem? It costs a lot less than the hundreds of millions of euros, and also it's a good chance to collaborate all together because it's a multi-center European. It could be a multi-center European trial. But please, let's not use the key opinion leaders to run the trial. Let's use some obscure researcher, not me, because I don't run trials before you jump to the conclusions. Let's use some obscure hospital doctor or GP to run these, not the usual key opinion leaders. Because remember that the majority of these guys are actually being made. I can't name any names, but I think you know who I'm talking about, because I don't want to get sued or even worse, clobbered in the street after this. So please, we trust democracy. We trust you as elected representatives. We need a surveillance system which works, or we abandon it, and we need interventions which work, or we don't use them, and we use the money to relieve suffering in some other way. Thank you.
Merci.
Thank you, Dr. Jefferson. In any case, we heard your appeal. And what we can do, we will do to the best of our ability. Mr. Hus has asked for the floor. Yes, thank you. I'm Jean Hus. I'm a member of the Parliamentary Assembly and of this committee. I come from Luxembourg, and I'm also Vice Chair of the National Patients Association. At the same time, a member of the board of the biggest hospital in Luxembourg. And from the information I received from Vudical, my director, fewer than 5% of doctors, of specialists, were vaccinated in an environment where the virus was likely to spread. So the doctors were not really convinced that there was a pandemic. Perhaps I could make several comments about this pandemic. Firstly, I'd like to congratulate the speakers, of course, and above all, the Polish Minister of Health for her very precautionary attitude. She was the one who adopted the precautionary principle as regards health policies and this mini flu, this so-called pandemic. This today several times the word scam or manipulation were used. And that's my view as well. But this isn't the first time we've been manipulated. The same thing happened 2 or 3 years ago with avian flu. There too we were told there'd be hundreds of thousands of deaths in France from the bird flu, and there wasn't a single death. And 2 years earlier, in 2003, the same thing with SARS. We were told that this was going to be a major disaster. But in fact, there too, it was really very minor, very benign. So I think with what Ms. Rivasi said, by next year there will be the virus of the Australian antelope or some other kind of virus, and things will be going very well for the pharmaceutical industry, who will be selling us vaccines or medicines like Tamiflu. Its inefficacy has been proved. But 2 years ago, that emptied the coffers of the health ministry, because the orders of Tamiflu made by the health ministry represented tremendously high sums as well. Let's take, if we just add up what was spent on vaccines for this flu, apparently $40 billion has been spent, and that's gone to the 4 major vaccine producers, and that is not chicken feed. If we base ourselves on the principle that vaccination will be the new fashion in health policies of the pharmaceutical companies, the shareholder value of those firms will increase even further. That's obvious. And this gives rise to a question about pharmaceutical companies in general and their influence on health policy. Because I think this h1n1 flu is just one example of that. Perhaps it is the example which broke the camel's back. But I think they made a mistake this time. They went too far. It was too visible. This scam this time was just too obvious. And I think it was a bad move on their part and for their own interests, because now they have a problem of credibility, not just the credibility of the WHO, but the credibility of pharmaceutical companies. And I think after this report on h1n1, we need to think of having a report on the strategies of pharmaceutical companies and how they try and influence health policy in their pure commercial interests. And I think that's the report we need to write in the future. Now, I have a couple of minor questions. One to Mr. Jefferson on the links between the h1n1 virus and the number of fatalities we've heard of. We've heard of 16,000 and several hundred deaths linked to the h1n1 virus. What does this mean? Among that number of deaths, is it just the mere presence of h1n1 in the blood? Is that sufficient to say that the deaths were caused by that virus? Were other viruses present analysed, or bacteria which could have caused the death? And then, what is looking at it from the other angle? Do we know the number of secondary effects, the number of deaths, for example, or cases of paralysis, not just the benign side effects? Are there any figures on this, or when will we get figures about all these side effects imposed on the patients? I've just read the documentation of an excellent scientific conference in Poland, organised a year or two ago at the university, on the role of adjuvants in vaccinations. And Dr. Jefferson, I don't quite agree with you on the role of Timmy Roche with autism. I've heard about massive fraud committed by the CDC and the University of Aarhus in Denmark, where the people who carried out the study on Timirosol apparently have now been accused of, and one of the scientists has actually made off with 10 million, whatever the Danish money is, 10 million kroners. He made off with 10 million Danish kroners. And now there's a trial against that, there's a prosecution against him. And he's a person who got the money from the CDC to prove that autism had nothing to do with Timirosol. And he carried out a study saying that Timirosol was removed from vaccines in Denmark, but autism continued to increase. And apparently people have seen now that study was completely fraudulent. So this is questioning the scientific experts. I think and this is my final point, I think we need new scientific expertise in these areas. And this must be perfectly transparent, and it must be independent, and it must be, both sides must be represented, and it must be public. We can't have a situation where the experts are behind the scenes. We don't know who they are, who's appointed them, and they can decide on what degree of pandemic should be declared, or they can decide that certain substances are not detrimental to health when we know full well that they are. And I think we need to change that. We need to change scientific expertise, and I myself at European level will be fighting to achieve public, transparent scientific expertise with both sides represented. Thank you. Mr. Volonté. Thank you, Madam Chair. I too would like to thank the rapporteur and the experts, the minister and the other experts. And I imagine how lonely you must have been just a few months ago. You challenged the politically correct. I was very struck by what our guests have said, in particular Dr. Gentilini, when he was talking about general practitioners, family doctors in Italy, but I think in other countries as well. This George Orwell's Big Brother saying that vaccination was essential for children and for elderly people and for pregnant women led to the hospitals being overrun over the winter. And many doctors working, many family doctors or those working in accident and emergency had a great difficulty persuading the parents that the child just had a headache or just had one of the many symptoms of flu. And we could continue speaking about this experience, which had led to very high overheads for our European countries, in addition to excessive worrying for many parents in our countries. I'd like to put some questions, though. What credibility, or how can we rebuild credibility? How can we provide more transparent checks within the WHO and within EMEA, the European agency, to avoid this happening again in the future? Obviously, through the work which our colleague Mr. Flynn is carrying out, and through the Committee of Investigation, which the European Union is setting up, we need to enter into commitments to avoid this happening again in the future. We have to bring about changes in these two organisations to avoid a repetition. I am particularly concerned about the responsibility for side effects. The side effects now in adults and the possible side effects in the future in the newborn babies who were compulsorily vaccinated on the advice of the WHO because their pregnant mother last year was vaccinated. I think it's not really credible that Minister X, Y or Z will be liable for the side effects, which he's not even aware of. Third question. For months after the publication of the very obvious data about the effect of the flu in Australia, far fewer deaths than normal ordinary seasonal flu causes in Australia. And we could say the same thing. It's now the end of the flu season. But after the publication of those data, I think it is essential that we ask for a reduction from level 6 of the pandemic. Perhaps, and I'd say this to Dr. Jefferson and Professor Gentilini, perhaps we need to go back to an older definition which is more in accordance with the real rules of pandemics. And perhaps the WHO should actually own up to the mistakes it's made. Because it seems to me that the contracts entered into individual European governments, but until such time as the WHO downgrades the level of danger, it can't remain so high because the data, the real data, are totally different from the forecast. But until the pandemic is downgraded, our governments will have to carry on buying the vaccine. And from what the Polish minister says, they have a legal obligation in relation to the pharmaceutical companies who acted in a perfectly shameless way. But they, knowing full well that there was a certain degree of complicity. Now, if we can say that if the WHO doesn't downgrade from level 6, there's something else which we are unaware of, and what we're unaware of is not at a scientific level, it's at some other level. And the final question, my fourth question I'd like to put is the following. If funding to the WHO causes a conflict of interest, because WHO's sole interest should be global public health. If this involves different merging interests, it's obvious that they would be led into temptation. And this would question the WHO's powers of judgment, just as where we said at the outset on controls. It might be a good idea to introduce in the parallel work which we are doing, thanks to the report of Mr. Flynn and the work of this committee, that both our individual member states and the EU investigation needs to introduce a mechanism to avoid these convergent interests in the WHO. Chair, thank you. I now give the floor to Mr. Koch.
Merci.
Microphone, please. Microphone went off.
D'accord. Merci, Madame la Présidente.
Thank you, Madam Chair. I would first of all like to congratulate the speakers. They provided us with very interesting statements and comments, just as many of the committee members had done during the last meeting in Strasbourg, which is in the minutes of that meeting. We asked very many questions in Strasbourg. First of all, relating to the definition of the pandemic. Is this a real scientific definition? Was it at any time modified? We also asked the WHO as whether it had been under the strong pressure of pharmaceutical companies. We asked whether there were experts who worked simultaneously for the WHO and the pharmaceutical industry. We asked about the overall purchasing plan for vaccines in Europe, country by country. We asked what the proportion of the population who were vaccinated in those countries. We asked about the mortality rate for seasonal flu and the h1n1 flu. Dr. Jefferson had told us. So we put a lot of questions during that meeting. Now, if I were a journalist, after this meeting, I wouldn't know what to put in the headlines. But now I could say this. For the Polish minister, the Polish government refuses to be held hostage by the vaccine manufacturers. For Mr. Gentilini, my headline would be that you'd have the option between two. WHO realizes its fault but remains quiet. That's a pity. But the scariest thing you said is that those responsible for this disaster might very well repeat it. For Mr. Jefferson, having analyzed what we've experienced, I'd say we don't know what lies in store for us. For Ms. Yassi, we are confronted with manipulation and staging of events. And if we don't regain trust and credibility in the WHO, what will we do? I invite you to closely read Mr. Flynn's report, and I would like to congratulate Mr. Flynn. I would particularly draw your attention to paragraphs 17, 18, 19, 20, and 21. These are very important paragraphs. And I will conclude by saying that I believe that the world, especially the public health sector, cannot afford to rest upon privatized science. Thank you very much, Madam Chair. Thank you, Mr. Koch. We still have two members who have asked for the floor. Briefly, you see that we don't have that much time, but nevertheless we do have to keep an eye on the clock. Mr. Free for a question, then Mr. Guthrie, and then we will have a concluding round.
I'll be very brief. Can I say that I will be certainly telling the 200 Poles who live in my constituency to make sure that they vote for the health minister if they have an opportunity. I think she's shown herself as a politician not only of good science but of rare courage, because other politicians throughout Europe have faced the same offer from the pharmaceutical companies: either do what we tell you to do, or you might face ignominy and shame because the virus might mutate and there might well be tens of thousands of deaths in your country, and you as a politician would be responsible. And the majority of the politicians of average courage caved in to the pharmaceutical companies and did what they were told to do. And I think it's marvellous that we've had a clarion call here today asking for European solidarity. We had another argument with the WHO some years ago about the suppression of trials, of evidence about the damaging effects that came out on the trials of a SSRI, a Seroxat. And we know now that our protests were right. There was evidence that GlaxoSmithKline kept secret, and it showed that people taking that antidepressant became violent, and some of them murdered their whole families, some of them took their lives because they were taking the drug. And that information was suppressed. And when we took it up with the WHO, they said to us, oh, we don't take any notice of what the pharmaceutical companies tell us, but of course we do listen to the patients' associations and the charities. The sad fact is that 90% of the charities and the patient associations take money from the pharmaceutical companies, and the tentacles of the pharmaceutical companies go very deep where any decisions on drugs are to be made. And you are to be warmly congratulated, Madam, and I hope your courage spreads to other nations. And just a brief point on what we had some marvellous presentations here today. But the point that was made about the idea that a pandemic is anything that the WHO decides that it is. I mean, this is not only bad science, this is evidence-free science. This means that the huge decisions affecting $40 billion are taken on what? On the needs of companies to increase their profits. I mean, if this is what's behind this, this is a scandal of huge proportions, and we must get to the truth.
Merci, Monsieur Flynn.
Thank you, Mr. Flynn.
Oui, merci très brièvement pour une question d'information et aussi d'opinion.
Just one question for informational purposes to Dr. Jefferson. I believe that what is of importance in all this is the future and what it might hold in store. You said at the outset that specialists and scientists don't know how to tell the difference between the real influenza and the flu or influenza-like illnesses. And you can say that only scientists can give us the answers for the future. So my question is to you is then, if that is the case, who can give us the real scientific medical data for the future?
Merci. Nous allons donc.
Thank you. We will go around the panel again. I will begin by Ms. Rivasi earlier, since I forgot to give the floor on the previous round. I do apologize. Please be brief, because we don't have much time. Ms. Rivasi, thank you for all these questions. This shows that when you put one question, many others arise as well. And at the same time, we have to focus on building the future. And this is what I'd like to focus on at this point. Dr. Jefferson's statement shows clearly that we have a shortage of scientific studies on even the regular seasonal flu. I was quite surprised to see that the h1n1 flu led to 300 deaths, whereas the seasonal flu apparently causes between 3,000 and 7,000 deaths every year. Now, I'd like to have these data established. I'd like to see these figures, because for me, for the time being, this is virtual data. So we have a shortage of studies also on the cause and effect link. When we say that this particular person died of this virus, but then you see that at the same time that particular patient had respiratory problems or diabetes and so on. So how can you establish in the clearest terms possible the cause of death? And the cause of death in particular stemming from a specific virus. You said earlier that it's not that simple. These deaths can be caused by many other things. But with respect to side effects, again, we're dealing with the same thing. When we, for example, have a vaccination and then we have a stillbirth or other side effects, we're told, well, the cause-effect link is not clear at all. So on the one hand, we do have this effect, and on the other, this link, and on the other hand, we don't. So we can see clearly there's a shortage of reliable medical investigations. And then we come to the question, what is an independent expert? When I founded our body, we looked into this issue. What I mean by independent is an expert who is not dependent on the pharmaceutical, on the lobbies. So if that's our choice, we will choose someone who is not dependent on any pharmaceutical lobby. But at the same time, I think we need some sort of link between the WHO and the European Union. The WHO will work with respect to the WHO on the clarity of their communications, on the way they choose their experts. But again, in Europe, I would say that the EMEA and the ECDC did not play their appropriate role, the role of counterbalance to the WHO, because the EMEA the European Medical Agency simply followed what the WHO stated completely, and so did the ECDC. Why did they do that? These two European bodies could have some leeway, could have some greater autonomy, and say to the countries, no, maybe the WHO says one thing, but you don't necessarily have to run massive vaccination campaigns, and if you do, we can coordinate to buy vaccinations together, and so on. But everybody simply follows the WHO as if it spoke the absolute truth. And I think that's something that needs to be questioned. Now on side effects, there will be a directive coming out on the regional and national centers, but I think that we have a tendency to see a proliferation of different types of information. In order to get doctors to notify, we have to get patients to notify. So we need a European source, and we need other sources as well. I think that we need several different types of sources at several different types of levels, and then we need to coordinate them. Because when you see the weight, the power of the pharmaceutical lobbies, this will certainly not be easy, but we should try to bring in a diversity of information sources. Thank you. The Minister? Mr. Trevor.
Thank you very much. Thank you. I'll take advantage of this opportunity to take the floor as someone in the Polish government who is responsible for negotiations with pharmaceutical companies. I can tell you that in 2009, something extraordinary happened. No one has mentioned this on this room today. It's extraordinary and very dangerous. Never up until now has an entity responsible for producing medicines tried to shift the responsibility to the government of the country buying the medicines concerned. Now, each of the pharmaceutical companies, although I won't name them, has tried to negotiate a contract that would shift the responsibility for any side effects to the government of my country. And you, as representatives of various European states, well, I can tell you that your governments did sign such contracts that shifted responsibility to your governments. I have copies of those contracts, of those agreements. They're confidential and I can't share them with you, but they did fully shift the responsibility from the pharmaceutical companies to the governments buying the vaccines. And that is very dangerous, an extremely dangerous precedent for the future. And I very much hope that today's deliberation will ensure that something like this never happen again. There shouldn't even be an attempt by the drug companies to do this. Poland is a member state of the European Union, and in the 37th article of the corresponding of our law on medicines, it is said that the Polish Minister of Health, if she were to sign such a contract, or if she empowered me to sign it, she could in fact be charged before the Supreme Court of the land. There is an absolute prohibition for such responsibility to be shifted to our government. I don't know whether that is true in the laws of other member states of the European Union. Now, why is the pandemic announcement still on the books? Well, I can tell you exactly why. 3 vaccines are registered by the European Commission as being saleable under pandemic conditions. If the WHO were to announce that level 6 no longer pertains, then that authorization would be withdrawn. And all of the drug companies would have terrible difficulties because they would have to have them authorized in individual countries separately, and they wouldn't be able to sell them on the market. Another aspect to all of this that is absolutely extraordinary, in accordance with this registration under pandemic conditions by the European Commission, from the date of registration, each of these companies had the right to import into my country or to your country to bring it to wholesale warehouses or to drug companies or to pharmacies, and I proposed this in October of last year to the drug companies concerned, and up until now, in March, none of them has brought this vaccine into your countries under normal marketing conditions, only through the government. How can you imagine if some car manufacturer were to be selling his cars the way those vaccines are sold? That means that what? That the governments of the countries where the country was purchased would have to fix those accelerators that are getting stuck and causing people to have accidents. This is a very dangerous precedent indeed. Watch out for it. Make sure this never happens again. Ladies and gentlemen, it's difficult to imagine better profit-making than in 2009, 2010. I mean, some people say it was 20 billion euros, some people say it was $30 billion. Nobody knows the exact figure, but it was certainly very fast money. A large number of vaccines that had not yet been produced were sold, and when the pandemic registration was decided in October of last year, the vaccines didn't even exist yet. It was agreed that because of the pandemic, I mean, if you change H1 to H5, you'll all of a sudden have a wonderful vaccine. I mean, I know of no case where a modification in a drug before it is marketed not be subject to clinical trials in accordance with the usual procedures. Now, I don't want to exaggerate the side effects. All drugs, all medicines have side effects. There are no panaceas. But we're very pleased to participate with you in this hearing, but we must work together to make sure that individual, private, particular interests do not make it possible in the future for some moral pressure to be exerted in that way on WHO and on governments. And the WHO should not be forcing anyone to do something. I mean, the European Commission can force the governments of member states to do certain things. The WHO should not be in a position to do that. But it will be terrible if the WHO does not confess and does not admit to having made a very serious mistake, and that could be very serious for the future, because if something happens in the future that is truly dangerous, there can be very great differences of opinion in this regard, and that could have terrible consequences. Thank you very much, Mr. Twardowski, for those very interesting comments, and I give the floor to Mr. Gentilini.
Mr. Gentilini, I would also like to thank the speakers presently and the members of the committee, because I've learned a lot and have been enriched by the contributions to this discussion. A few things. I think that we should recall to the public health officials what their duties are. I think that we should all make sure that survival is not too disagreeable and that extreme stress is bad for one's health. Secondly, a friend who's a virologist told me, you know what, there are two types of virus specialists. There are those who are specialists in the major viruses and those who are specialists in the minor viruses. Those who are major virus specialists have had their hour of glory with the emergence of new diseases such as the AIDS. These are also the specialists of the Ebola virus or the SARS or chikungunya virus specialists. And then there are the small virologists who were hidden away in the woodworks that we didn't hear much about, that we'd hear about every season, but who hadn't had their heyday yet. Who we'd hear about when we went to get the seasonal flu virus, but they've come out now. These are the flu virus specialists. Ladies and gentlemen, I'd like to recall that there is a need to build up the health Europe, the Europe in health matters, and we must agree to convince the decision makers who were wrong that we will never accept this again. Thank you. Thank you, Professor. Before I give the floor to Mr. Jefferson, I would like to say goodbye to Ms. Kovac. She needs to go to the airport and catch her plane. I would like to thank her very much.
I, too, thank you very much for your attention. I was very pleased to be with you to participate in the hearing.
Thank you very much. I think I've got 3 minutes, and it's a very short time. Very difficult to explain. 2 issues. Causality. Well, the main issue is causality. What do I mean by that? How many of these deaths are due to h1n1? That was the question. Why do we have so few deaths for h1n1 compared to seasonal influenza? Well, it could be that it's a milder type of influenza, but I'll give an alternative explanation. Epidemiologists usually do give alternative explanations. They can think of any other explanation. And the explanation is as follows. Seasonal influenza death or influenza-related deaths are guessworks. The figures of seasonal influenza are guessworks. They're models. They are based on the very old idea of excess winter death, which made its way into the world in the middle of the 1800s. Okay? So maybe, that's an alternative, that this year people were actually followed and each person who was unwell was tested. And that may be that 410 deaths in Canada, I think is right, is the actual level of influenza impact. But you're quite right, sir. All we hear, Mr. Huss, is they were positive for h1n1. We do not hear whether they're positive for RSV, positive for rhinovirus, positive for any other agent, and we do not have the clinical description of the cofactors. It's just slogans. Like in Italy, there was a child who died in Naples, and it was first, front page, h1n1, yes, and then there was something else as well. This poor child was suffering from other. So we don't have that. It's partial information, which brings me on to the answer, or a possible answer, as to what can we do to get the system better. The first thing is a reasonable surveillance system, intelligence gathering, but it's not fixed on just influenza. It looks at influenza-like illness and other causes of other bugs. That's a possibility. I haven't got time to go into that. The only other point I would like to make is the one on adverse events, harms, okay, side effects. Now, there are different sources of information on side effects, on harms. One is pharmacovigilance, which is the reporting during normal consultations. It's very problematic to make any sense out of this data because it's partial. It relies on the doctor doing the notification, and there is no comparator, i.e. there is no child which is exactly the same age and condition which doesn't receive the vaccine. So you can't really establish causality or even probability. And the second way is during formal studies. Now this slide here shows you, again, I go back to this, I've got this fixed idea of scientific evidence. 281, and this thing doesn't work again. Never works anyway. Can I get up? You mind? 281 studies. 281 studies.
That's the defective microphone.
So that microphone, it doesn't work. You need to use one which does.
Oh dear. Influenza vaccines with do nothing. Okay? So this is the best way to look for harms, for side effects. These are formal studies. Yes. Okay. Thank you. In these, you have the gold standard, which is randomized control trials, but these randomized control trials are too small and too short to look for rare and long-term effects. Okay? So the best possible type of study is this thing here called a cohort study. Okay? So we had 115 cohort studies, and 90 didn't look at all at safety. all published in prestigious journals and all the rest of it. But 90, they possibly had access to the data and didn't report it. 10 had what we call a one-liner, which is nothing, it's a joke. And 15 looked at it. So really harms from these vaccines are not taken very seriously. That's the message that you get from here. They may be safe. Safe, of course, is a relative term, not an absolute term. But they may be safe or acceptable to the public. They may not. But the data are simply not there. Now, to cap it all, in the early 2000s, I was part of a study called USAFIVAC, which DG5, I think, if I remember correctly, funded. And we made proposals for a Europe-wide surveillance system, which is better than the present one. Because the problem that we have now with vaccines adverse events is that we have so many vaccines that if a child is ill after a vaccination, you do not know which vaccine is possibly associated to that. We needed to have a registration, prospective registration, and use maximum data. But unfortunately, the proposals were never funded, the system never took off. So we are left with, I think, little more than guesswork now. As far as the adjuvants are concerned, we asked EMEA for the data, the safety data, and they said, sorry, our experts have seen it, but they're not available, which is a complete contrast with what the FDA policy of openness. Now, my last point is this. These were vaccines. They're not just any vaccine. These were pandemic vaccines. And I, being a double taxpayer, paid twice for them. So why are the data not released to me as a taxpayer? Why? Is intellectual property of something that I paid for? Does that make sense? Or I have to sign a blank check. What in Italian is called un assegno in bianco. I have to sign a blank check to an expert or the EMEA official. Why does the FDA have an open access policy and not the MEA? Why? Give me a good reason for that, because I can't see it. So I can't answer your question of whether they're safe or not. I don't know.
Merci, Dr.
Thank you, Dr. Jefferson. I'd like to thank our three remaining speakers. We've already taken our leave of Mrs. Kovacs. I'd just remind you that in a few minutes, the hearing will be online. It will be webcast so that people who are unable to attend will be able to see it. We will, of course, continue our work on this very important subject at our next meeting in April, following the visit which Mr. Flynn and I will be making to the WHO on the 15th of April. Now, I remind you, there will be a press conference in a few minutes' time in this room, just a time for people to rearrange themselves, and I hope you have a safe journey home and happy Easter.